Hey, Lintice.
Hey, Lintice.
Hey, Lintice.
Hi,
Great.
and it's nice to see you all. Thank you all so much for the love, support, and cards and gift cards. I missed you all. It's nice to be with you today.
We're so happy to see you.
Thank you so much, Lintice. It's great to see you. Hello to those that have just joined us. So we're excited about this presentation. We have Dr. Sherilynn Cooke. Dr. Cooke is an internal medicine physician. She's the president of the Sinclair-Miller Association. Many of you may be familiar with Sinclair-Miller. Some of you may not be. Sinclair-Miller has been a leading association of, and I will speak specifically to the fact that they're primarily mostly African-American physicians. They have other races, but it is a leading Black physician group. And I had the pleasure, thanks to Dr. Cooke, to present to the Sinclair-Miller physicians 3 weeks ago, maybe, Dr. Cooke?
Yeah.
And was really appreciative of the response that we got. And I had the opportunity to share the work of the ACCA and then talk about opportunities for potential referrals even from the group. So thank you, Dr. Cooke, for being with us today. Of course, Dr. Cooke's presentation is going to be on COVID-19 and vaccinations in particular. So without further ado, it's a little after 12 noon. I think it'll be great if we can go ahead and get started and have opportunity for Q&A. So introducing Dr. Cooke.
Thank you very much, Reverend Cynthia. I appreciate it. I appreciate your presentation that you did to our members. Actually, our meeting is Thursday, so it'll be 4 weeks on a month on Thursday that you came and presented to us. So, and I'm really excited to be here today. Obviously, COVID-19 is a huge issue, but there's still a lot of questions that people had about COVID-19 and, you know, the vaccination. So I personally took a deep dive into it because, you know, it was somewhat new. So I needed to be comfortable myself. So I took a deep dive into it so I could learn more and share what I know with other individuals. So I'm going to go ahead and share my screen and get started. Okay, so can everybody see my screen?
Yes.
Yeah.
Okay, good. Okay, thank you. So as Cynthia mentioned, I'm a primary care internal medicine physician, trained here in the Bay Area at Stanford, and actually did residency at Highland Hospital. And President Miller for several years now. And just so you know, I don't have any financial interest in COVID-19 vaccines. I did not invest. So just want to be clear about that. But what I wanted to cover as an overview are basically try to answer 5 questions, and then we can go into more questions that you have. But the questions are, why is the vaccine important? How do the vaccines work? How were they developed so fast? Are the vaccines safe, and are there side effects? So first of all, this, you guys have all seen this picture, and this is a electron micrograph of a COVID-19 virus. So what I would like you to do is just take a really good look at it. It, you know, the color is just irrelevant, but in this case, it's a gray sphere with these red structures coming out of the side. And these structures are called spike proteins. So it's really important to just take a good look at this spike protein, because this will really help you understand how the virus infects us and how the vaccines work, because the spike protein is critical to that. So first of all, I looked up data yesterday or on the 15th, and there's over 29 million cases of COVID-19 so far in the United States. And when I did the presentation back in December, there were about 350,000 deaths. And as of the 15th, we have over 533,000. So there's been an exponential increase since the first of the year. The case per day rate is going down. So it's not increasing as exponentially as fast, but the death rate is still going up. Another thing that I found really fascinating, if you look back to February 1st, 2020, prior to that, we were unaware of any deaths of COVID-19 in the United States. But between February 1 and January 2nd of 2021, COVID-19 became the third leading cause of death in the United States. And prior to February 1st, 2020, it did not even exist. So I just find that staggering. If you think about all the work that has gone into a lot of the diseases up here for years and years and years to try to get the rates down, of course, heart disease and cancer still outpace COVID-19, but it's the number 3 cause of death, which is really, it's really striking. So who does COVID-19 affect? Well, first of all, it can affect anyone. It's sort of in general, an equal opportunity disease, but it disproportionately infects certain groups. And those groups tend to be communities of color, elderly people, essential workers, those who cannot work from home, they have to go into their workplace, and those in cramped conditions. And cramped conditions can either be on the job or it could be at your home. So if you think about cramped conditions, like one of the major outbreaks that occurred in California was at a chicken processing plant in the Central Valley, where people were working very close together, almost shoulder to shoulder along a production line. And it's an enclosed environment. So you can imagine there was a lot of airborne spread in that situation. Also, if you think about multi-generational families where you have the grandmother, the parents, the young adult kids and the grandkids, 4 generations living under one roof, people, obviously share bedrooms, but, the more cramped the conditions, the higher risk you are. There's also been a lot of talk about underlying conditions, but if you think about it, when you take a look at older people, they have more underlying conditions than younger people, and communities of color. And this is really multifactorial, but there's underlying, racism in medicine in particular. And if you have communities of color that have lack of care, they don't get diagnosed early, they have underlying medical conditions, they're just primed and waiting for this virus to come through and ravage those populations. And that's what's been happening. But we're here today primarily to talk about the vaccines, because the way I view it is hope is here, hope is on the horizon for this. So currently, we actually have 3 COVID-19 vaccines. Pfizer was the first to come out earlier this year, and it was shortly followed by Moderna about, a week or 2 later, and then Johnson & Johnson just came out in the past few weeks. And one thing I want to point out is, okay, Pfizer's 95%, Moderna's 94.5%. That's really insignificant. They're the same. But Johnson & Johnson is 85% at preventing severe disease. So one thing that you got to keep in mind is that Johnson & Johnson lagged behind Pfizer and Moderna. So the time Johnson & Johnson was going through all their clinical trials, there were new variants going on. And some of the studies on Johnson & Johnson were done in South Africa, and we've all heard about the South African variant. So Johnson & Johnson is the only one that actually has been tested on a population that had the South African variant circulating in it. So quite frankly, we don't know with Pfizer and Moderna how effective they're going to be on the South African variant because they weren't tested on it. But the other thing I want to point out is that, there's been some press about Johnson & Johnson only being 70-some%. It's not as good, but if you take a look at what matters is, are you going to be sick enough to be hospitalized, and are you going to die? Johnson & Johnson is very effective, 85%. And again, that includes those South African variants. So Pfizer and Moderna might be a little lower than what they say. We don't really know. So my perspective is all of them are very effective. And if you think every year most of us get the flu shots are between 30 and 60%. So all of them far exceed the effectiveness of the flu shot. So just keep that in mind. So how do they work? So first of all, any vaccine, including COVID-19 vaccines, what they do is they teach your immune system how to fight a virus. And in this case, it's how to fight off COVID-19. So every vaccine, that's its job, to teach our immune system how to fight this virus off, because it's our own body, it's our own immune system that's actually going to have to conquer this disease. So this is a schematic of the messenger RNA vaccines, which is Moderna and Pfizer. These were the first ones to come out. It's important to know that this is the first time they've ever used messenger RNA in a vaccine. So this was new. So we're going to get a little bit more into that, but I just want to share with you some of the science about how it works, because it's really not that complicated. But you remember the COVID-19 virus picture? Well, at the top, there's a picture of a virus. This one happens to be pink with the orange spikes. Those are the spike proteins. So the spike protein is really what we're interested in here. And back in January of 2020, scientists were able to figure out the genetic sequence of the COVID-19 virus. The internal part, the reddish pink part, that's where the infectious genetic material of the COVID-19 virus lives. The spike protein is simply a mechanism for it to attach to our cells and to introduce the infectious part into our body. So what scientists did is they were able to take the genetic sequence and synthetically make a piece of the a piece of the messenger RNA that gives information on how to make a spike protein. So keep in mind, all of us have messenger RNA in our bodies. So if we pull a muscle and you have little microscopic tears, like even a strained ankle is microscopic tears of your muscle and your tendons and your ligaments that are holding that ankle together. There's torn tissue that's damaged. It needs to be repaired. We all have messenger RNA whose job is to come in to tell our cells how to make that protein to repair that muscle. So messenger RNA, our messenger RNA is not foreign. We all have it. But what the scientists did is they synthetically, put together the genetic sequence to make the messenger RNA that is basically instructions for the body on how to make this spike protein. So what the vaccine does is they have the messenger RNA that encodes for how to make this spike protein into the vaccine. When they inject it into our body, the messenger RNA is able to attach to our cells and deliver that messenger RNA, and our body is actually what produces this piece of spike protein. And I was curious about how this messenger RNA is going to be able to do this. And we'll talk about that a little bit later because it's quite interesting. But anyway, the bottom line is the messenger RNA gets in, our body makes the spike protein, and then ultimately our immune system says, hey, wait a minute, this piece of protein doesn't belong here. This is not human. We don't like it. So it starts developing an immune response to this spike protein. And so we make antibodies. We have these T cells and B cells that are all part of our immune system, and it starts ramping up to come out and attack this spike protein. So this is the new thing that this messenger RNA that they've synthetically made. It's not an actual live virus. It's just synthetic. It tells it how to make the spike protein. So the question is, how is this different from other vaccines? So to really understand how this is different, but also similar, we're going to take a look at all three types of vaccines. So there's basically three types of vaccines, period. There's a protein-based vaccine, there's what is called a viral vector vaccine, and the messenger RNA vaccine. And if you look at this diagram, all of them end up with our body's immune system producing antibodies against a spike protein. So we've already gone through the messenger RNA process where they synthetically make this messenger RNA, gets into our cells, and our bodies make the spike proteins, then our bodies make antibodies to the spike proteins. So if you take the protein-based virus, this is like the flu shot. In the flu shot, they have to grow flu virus every single year, and they guess what flu strains are going to be out, and they guess what's going to happen. So the flu virus every year may have 3, 4, 5 different strains in it, but they have to culture and they have to grow that virus. And they take a little piece of it and they sort of what they call attenuate it. It's basically they kill it, but it's not all the way dead. I mean, you still have the protein available. So they purify it, put it in a shot, inject it directly into us, and we make antibodies. So that's the same thing that would happen in a protein-based coronavirus vaccine, but we don't have one yet. We don't have one yet. But they would take the protein, they would just attenuate it, purify it, inject it, and we make antibodies. Now the Johnson & Johnson and the AstraZeneca, which is not approved in the United States yet, Johnson & Johnson has emergency approval, just came out, and that's the one that's one shot. You guys all know that Pfizer and Moderna are 2 shots. But in the viral vector vaccine, what they do is they take genes from the actual coronavirus, and it's kind of like a 2-step process. They purify that gene, and that gene, again, is instructions on how to make the spike protein, but they put it inside a viral vector. And in this case, it's like an adenovirus, which is a cold virus. So if you imagine you have a cold virus, you take the genetic material for the cold out of it, and you put this genetic material for the coronavirus spike protein in it, and you inject that. And again, our body makes the spike proteins, and the end result is we develop antibodies to it. So this type of vaccine, viral vector, has been around before, but almost all vaccines in the US are protein-based. Which is like the flu shot. They grow it and they just purify it. They make it so it's not infectious, but you got enough protein in there to get an immune response. The only other viral vector that's been approved in the United States was for dengue fever. And it's the same type of technology. So it's been around a while, but Johnson & Johnson has emergency approval. It's not pending any longer. It's emergency approval. And then we have the 2 viral vectors. So one of the issues is the protein-based viruses take a long time to develop because you have to grow the viruses, which can take months. The Pfizer and Moderna were able to come out quickly because it was synthetically made based off the genetic code. So it's still, people wonder, well, why did these develop so fast? And the thing that I was not even aware of before I started researching it is while the messenger RNA vaccine, which are Pfizer and Moderna, they were developed very quickly, but it was really based on pre-existing knowledge. And it is the interesting story. There was a Dr. Kariko who immigrated from Hungary, and she was working on messenger RNA technology over 30 years ago, not really for vaccines, but for gene therapy and for some other things. But she started working in University of Pennsylvania, and she and another scientist developed a therapeutic use for messenger RNA. And it's important to know that both Moderna and Pfizer used technology that she developed. But it's kind of a fascinating story because she was on faculty. People thought her research was a little off the wall. She didn't get her tenure. She didn't get promoted. She got fired from a few jobs. And a lot of scientists feel she'll probably get the Nobel Prize in the next year or so. But Dr. Kariko is the lead scientist on the Pfizer vaccine, and her technology is also used in the Moderna vaccine. Another notable scientist is Dr. Kazmikia Corbett. She's a PhD who works for the National Institutes of Health. And it's of note that she's been working on coronaviruses for over 10 years. You all might remember when there was the SARS outbreak several years ago. Well, she was involved in that, and also another one, MERS, Middle Eastern Respiratory Syndrome, which was out in 2012. And she did a lot of research on MERS. Those are all coronaviruses. They're just different strains of coronaviruses. So she's got a lot of expertise and knowledge about coronaviruses. So she knew, and other scientists in this field knew, that if we're going to make a vaccine against this, we have to focus on the spike protein because that's what actually allows the virus to infect us. So she is actually a lead scientist on the Moderna vaccine. And going back to that diagram, this is just a different type of graphic that shows the spike protein, which is orange. And again, The genetic material that makes you sick is up in the top part where it says coronavirus, the little round ball. This spike protein's only job is to connect with what we call a human cell receptor, which you see on the bottom. And if you kind of think of it as a lock and key, to open the door, you got to put the key in the lock, turn it, connect, open the door. The only way coronavirus can get into our system is this spike protein connecting with the human cell receptor and opening to door, and then it can inject its material into our cells and make us sick. These vaccines only have the spike protein. They don't have the genetic material that can make us sick. So that's important to keep in mind. Another thing about how it developed so fast, there are 3 phases that any vaccine or any medication in the United States that gets developed has to go through to be approved by the FDA. And, you know, the first phase, you have a few healthy volunteers. And in the second phase, you may roll out more volunteers. And in the third phase, you have thousands. So honestly, they went through a lot of these phases very rapidly. And I kind of think about it, if you think about that, you know, extreme home makeover, or where they actually build new houses from the ground up in about a week, normally it takes about a year. But if you throw enough people and enough money, they still get the house up in a week, but it still had to pull the permits and get all the approvals to do it. So it's kind of the same way with these vaccines. They put a lot of money into it and a lot of people into it to get it done quickly, but it still went through all of those phases which are designed to protect us. And that brings us to the biggest things, dollars. They were developed fast because there was a lot of money thrown at it because it was such a huge worldwide pandemic, which was killing people. So the US government directly invested for over $4 billion in Moderna because it was kind of a small startup company. Pfizer was a big international company and they had enough money. They didn't want the government's upfront funding, but the government agreed to purchase 200 million vaccines before they were even developed. So there was a lot of money at stake. And of course, the money made things go really fast. So given that safety, are they safe? So again, they did have to go through all 3 phases to be approved. And they do appear to be safe for healthy adults because that's who the studies were done on. Moderna was age 18 and up. Pfizer did study down to age 16 and Johnson & Johnson studied down to age 18. There are still clinical trials ongoing. Pfizer's got I think they're starting at 12. They're doing research down to 12-year-olds, so the teenagers, and they're all looking at now, you know, doing the studies on younger people. I can tell you, no medication in the United States, they never have studies on pregnant women. They never have studies on breastfeeding women, probably because liability is so high. But the Association of Obstetrics and Gynecology has said this has appeared to be safe. There have been women who were in the studies who got pregnant during the studies, and they have not had any ill effects. So, but I'm just telling you, for liability reasons, you will never find any drug that's been tested on a pregnant or a lactating woman. So just keep that in mind. So Moderna, again, 18 and over, Pfizer, 16 and over, Johnson & Johnson, 18 and over. We talked about no pregnant breastfeeding or children initially, then they do that in the next, children they do in the next phase. Again, pregnant breastfeeding women doesn't happen. And the only contraindication to getting the vaccines are if you're seriously ill. So if you're in the hospital with pneumonia from some other cause, they're not going to come in and give you a COVID-19 vaccine. You have to be, you know, at least well. Or if you've had a severe allergic reaction, which is anaphylaxis, you know, had to be hospitalized with some other vaccine, they don't recommend it. And you know, if you've had like milder reactions, it's sort of a precaution. But, you know, there really aren't very many contraindications because the risk of not being vaccinated are much higher than the risk of being vaccinated. So just to review, messenger RNA vaccines cannot give you COVID because they have no genetic material of the coronavirus in them. They can make you feel like you have COVID because, again, your immune response is attacking that spike protein. And you know, it's going to feel kind of the same to you, but it's not going to be the actual virus itself. There's no live virus in the vaccines. The messenger RNA only codes for a piece of the spike protein, not the virus itself. And it's the same thing with the Johnson & Johnson. But then again, side effects. Are there side effects? And the answer is yes, there's usually side effects. So think about the two-step vaccines. Number one, you get the first shot, your body says, hey, I've never seen this before. This is interesting. And it starts making these antibodies. And then 3 or 4 weeks later, you come back for the second shot, your body's ready. It's primed. It says, hey, I don't know what this, I know about this. We don't like it. It doesn't belong here. So it really attacks those spike proteins on the second shot. And that's why most people have more side effects on the second shot. On the first shot, it's typically you'll get arm pain. Some people do get swelling. A few people get headache, a little fatigue. On the second shot, you get the arm pain again, but more likely to get muscle aches, joint pain, fatigue, headache. Some people get fever and chills. Some people get some nausea and vomiting. Most symptoms go away in about 2 days. Anaphylactic reactions, which can be life-threatening, are very rare and are easily treated. But when I look at the data, when I look at over 500,000 deaths from COVID-19 in the United States, we've given over 111 million vaccinations so far, very rare anaphylactic reactions, which can be treated easily. And there have been no proven deaths from the vaccine. Now, people have gotten the vaccine and they have died. But if you think we've vaccinated 111 million people, some of these people are going to die from something within a week or two after these vaccinations, or even the same day. But they have not been proven to be from the vaccine. So just in summary, I got the vaccine, but we still have to remain safe. We still encourage you to shelter at home as much as possible. The general rule is don't share your air. Wash your hands, and people do ask about vitamin supplementations. There's a few that do have some effectiveness against cold viruses, which are similar. So zinc, a good multivitamin, some vitamin C, and some vitamin D are all reasonable things. They haven't been proven to cure coronavirus, but I think they're reasonable things to do in, just in general to help prevent, I've been taking some of these supplements since the pandemic started. Some I'm taking, of course, vitamin D, everybody needs to take that anyway. So I got the shot. These are some of the physicians from Sinclair Miller Medical Association getting the shots. So, we are all doing it, and we are encouraging everyone to get vaccinated. And that's what I have. So thank you very much. And I can certainly, and we can have a discussion if there's questions that people have. And I'm going to figure out how to stop sharing this in a second. Let's see, stop sharing.
Thank you, Dr. Cooke. That was wonderful. And I'm sure there are questions or comments that people would like to raise. So some of you may want to put it in the chat, and others may want to just raise your hand and ask your questions. Either would be acceptable. Okay. I see Reverend Olu Bariola's hand. Are there other hands or wanting to put in the chat? Okay, Lynn Teese. All right, so we'll have Reverend Bariola first, and then Lynn Teese question following, and any others, please feel free to engage. Yes, Reverend O.
Yeah, hi. Thank you. I'm just wondering if you can go back a little bit to talk about some of those vitamins that I was writing it down, but you took it off the screen fast.
I took it off too fast. Okay.
Yeah,
There's been, well, first of all, one of the headlines was people who are dying of COVID-19 are vitamin D deficiency. And then they said, well, maybe that means, that people who are vitamin D deficient are more likely to die from COVID-19. But I can tell you from my practice, just about everybody I test for vitamin D are deficient. So we're all deficient. So it might help, but it certainly is not going to hurt to take supplementation for vitamin D. So it could be irrelevant. It might not even really be related, because of course, but there is some evidence that vitamin D might help in your immune system in fighting this off. The other thing was zinc and vitamin C.
What is the milligrams of vitamin D?
Vitamin D, I usually recommend about 4,000, what's called international units a day, 4,000 IU. Sometimes you can get them in a 5,000 IU tablet as well. But, you know, we're pretty much, and I personally spend a lot of time out in the sun on the weekends and when I'm off, but most of the time I'm at work inside. And even people, you know, brown skinned people, we tend to be, you know, vitamin D deficient. So yes, and that's important for your bones. But there's some evidence it's helping with your immune system, as well as zinc has been studied a lot with cold viruses, similar. So I think it's reasonable to take some zinc. And there's things like Coldies on the market, but you can buy straight zinc. And a good multivitamin is just a good thing. You really want to do anything that's really going to bolster your immune system, because again, it's our own immune system that actually has to conquer this virus if we were to get it.
And what about the vitamin C? How many milligrams?
Vitamin C, about 1,500 milligrams daily, and they come usually in 500 milligram pills. So you could take them 3 times a day with meals, or you could take a couple at a time.
Thank you.
Sure.
Thank you, Reverend O. Lynn Teese, and then Mary. See your hands.
Thank you so much for your presentation, Dr. Cooke. It was really meaningful and informative. I really appreciate it. I have a few questions. The first one being, you know, with COVID-19 and the vaccines, there's so many facts and there's a lot of myths. One thing that I recently heard was, depending on your blood type, it either makes you more susceptible or least likely to get COVID-19. Is that true?
The research does not support that. Yeah,
Okay.
there are a ton of myths floating around on the internet with that. And there have been people from all blood types who have contracted and died from COVID-19. So yeah, there's not any evidence that your blood type makes a difference.
Okay, thank you for that. And then the next question that I have in terms of, based on my understanding of the presentation, we can see that there are no known deaths from receiving the vaccine. But even in terms of as it was produced, like thinking 20 to 30 years from now, is there research about the impact that it will have on people? And I know that, like you said, pregnant and lactating women are not, generally don't get tested. But as I even think about daughter and like maybe her fertility or whatever her reproductive system may look like in 20, 30 years, you know, do you have any research on that?
Yeah, so that's interesting, because one of the first questions that I personally had was, what are the long-term effects? Because we have not had, you know, at that time, even 1 year of research on these vaccines. So how do we know of 2, 3, 4 years down the line? And particularly the messenger RNA vaccines, because that's the new one. The viral vector's been around. We kind of know what that does, and there have not been any long-term effects from these viral vector type vaccines. So I called up one of my classmates from medical school, who's one of the smartest people I know, who actually has a PhD in immunology, which is this field, and he's a neurosurgeon. He's one of the few Black neurosurgeons, pediatric neurosurgeons in the country, super smart guy. So anyway, I called him up. I said, hey, what are the potential long-term risk of, you know, these type of vaccines? And he said, basically 0. And the reason why, and you know, this was part of my learning process, these messenger RNA technology that they've been working on for 30 years, he said one of the problems that with it is when you inject this foreign messenger RNA into our body immediately recognizes it as foreign and destroys it. He said it lasted no time. So they couldn't figure out how to make it survive to even get into our cells to deliver the material to make the spike proteins. So what they came up with is they encircled the messenger RNA with a little tiny fat layer, and it's called a nanolipid layer. And that is able to protect it just long enough for it to get into the cell. And when it, you know, the messenger RNA gets there, and then once it's outside of that fat layer, it is destroyed, he said, immediately. So he said for 30 years, the problem was, and that's what Dr. Carrico figured out finally, how to actually make this survive long enough to develop its material into our cell to do the difference. So, he's like, it's not going to have any long-term side effects because this is so fragile, it just can't survive in our bodies. Our immune system simply attacks it. So it was just interesting having that conversation with him. He's like, no, it's sort of like as soon as it develops, it comes out of that little fat layer, it just, it's gone, it vaporizes. So, but the other interesting thing is another theory that was circulating when the vaccines first came out is they're injecting with, nano cameras. And I think they saw nano lipid layer and they kind of attached camera to that. And that started off on its own whole spin. So, but nano in science just means tiny. That's all it means, is tiny. So, but thank you for the question, Matisse.
Of course. Thank you so much. I really appreciate it.
Mary, and then Deacon Mike.
Wow, this has been so good. Thank you so much. And thank you for those questions, Letice, because some of those questions were on my mind as well.
Mm-hmm.
I wanted to go back to the thing with the vitamin D and the vitamin C. What about magnesium? I've been told that also, I take a combination of vitamin D, calcium, and magnesium. So is better than zinc, or should I add zinc?
Oh, you could just add zinc. So magnesium is really important in absorption of calcium into the system, because if you're deficient in magnesium, you can take all the calcium you want and you just won't absorb it. So, a lot of times calcium and magnesium are linked together, but yeah, zinc would be something separate. And again, none of these have been proven to really cure or ward off coronavirus, but they have been shown in some studies to kind of help boost your immune system, which again is what you have to do, because it's our immune system that's actually going to get rid of this if we in fact get it, but hopefully we're not going to get it.
Okay, and then my second question, I'm sorry. And my second question is, you may not have the answer to this, but my concern is like, there are all these new places where you can get vaccines and everything, but I'm worried about the people that can't get out. Is there anything where they have for people that, well, they actually go in the home to do the vaccines?
Yeah, no, that is very, that's really interesting. I know that, where I work, home health services will go into the home. In fact, I got an email yesterday about a patient of mine that's homebound and needs a vaccine. So they have to take the vaccine to her in the home. But in terms of how you access that, I think you would have to work with the patient's health plan, and it would probably have to be through a home health provider to get the vaccine to them. There are a lot of, that one of the big issues early on, as the African American community, the Latino community have been having disproportionate numbers of cases. And particularly in Alameda County, the death rate for African Americans far exceeds even the proportion of cases that we're getting. And vaccines have not been getting into the community. So one of the things that's happening is, you have like the huge site at the Coliseum, and then you have the county health department is running some sites. And actually now there's some local, in fact, I volunteered 2 weeks ago at what they call a pop-up. It's a site which was at a church, which I'll give you information about, where they're trying to get the vaccines closer into the community. You still would have to come out to that site. And, and there were people coming in wheelchairs and on walkers. I mean, ideally it would have been nice if someone could have gone to their home and gave them the vaccine, but if they can get in, they should get in. But if they absolutely cannot get in, then I would try to talk with their healthcare provider to see if home health could arrange getting them a vaccine.
Thank you. Thank you.
Sure.
And Dr. Cooke, Mary, who you just spoke with, is our care team supervisor. She's a registered nurse. We have other registered nurses. Mariana might want to wave. Angelique is another retired registered nurse. She can wave also if you're there. And I see Angelique. So I just wanted to call that out. Deacon Mike, I think you're next. You had your hand raised.
Yes. I just have a real simple question. Can we share this presentation? Because I have been having a lot of discussions about the vaccine, and I don't have a thorough I don't have a thorough like statement like you did, and the presentation was awesome. And I think this would like it clears up so many questions that I've heard and so many objections that people are coming up with, because everything's on the internet, and there's a bunch of lies on the internet along with what is true. So I think, and seeing the presentation done by church people, I think it'll hit impact that this is legit.
Absolutely, no problem.
Well, thank you.
Wonderful. So are you saying, Dr. Cooke, that we could have your presentation shared on website? I just want to be really clear about that.
On your church websites.
So there are all
Yeah.
you see a lot of different churches represented here across the Bay Area. Deacon Mike his church is in Berkeley. We're all over the Bay Area. So just wanted to be really clear on how to share the presentation. Or
I mean, I guess there's two ways we could do it. I can put it on our Sinclair Miller website, which you could access, but I don't have a problem with you sharing it on your church website.
Yeah, because I think the questions afterwards are just as valid, for people. There's a lot of the same questions.
Sure, absolutely.
there you go. Thank you, Dr. Cooke.
Mhm.
I know I saw another hand. I see Benny
Teresa?
Banks and
Teresa
Teresa. Let's go, Benny, Teresa, and then Reverend Olu. I saw your hand up again.
Hello, everybody.
Uh,
Can you hear me?
Oh, yes.
I got my vaccine in January and February. January 29th was my first and February 19th was my second.
Mm-hmm.
To date, I have not had any side effects. Basically, what I did when I came home on January 29th, I put an ice pack to my arm and just rubbed it up and down for about 20 minutes. So if there was any swelling to be done, I kind of nipped it in the bud. And on February 19th, when I came home, I just put some Vicks Vapor Rub on my arm because Vicks Vapor Rub has eucalyptus and menthol in it. So I just rubbed the entire upper portion of my arm with that, and I haven't had any problems.
Good. Yeah, we recommend, typically one of the things that's still a little bit controversial, but just to be on the safe side, I recommend taking Tylenol if you have any pain or any fever, ibuprofen which is Motrin, and Aleve are anti-inflammatories. So there's some reports that we don't really want to suppress inflammatory response because, again, we're trying to stimulate our immune response in this situation. So, but Tylenol is not an anti-inflammatory, so you could certainly take that. I don't think it's really a huge deal about the ibuprofen or Aleve if that's what you happen to have at home. But yeah, we treat the symptoms. So, just be reassured, even if if you don't have a reaction, that's wonderful. My mom had hers and she didn't have any reaction at all. But if you do have one, just be reassured it's not because you caught the virus from the shot. It's because your immune system is doing its job. It's activated, it's out attacking these spike proteins so that if and when you do come in contact with the real virus, it is ready. So that's great.
Wonderful. Teresa, was that your hand? I thought I called a couple other names, please. Yeah, you're on mute. There you go.
Okay, there we go. Going back to, let me make sure that, now you said if a person had COVID before and they get the injection, that doesn't mean that's going to stop it. That's supposed to slow it down, correct?
I'm having a little trouble hearing you, Teresa.
Uh-oh. Okay, can you hear me?
That's
Better?
a little better. Mm-hmm.
Okay. If a person's already had COVID
Mm-hmm.
and they get the injection, that doesn't mean that they cannot get it again, correct?
Okay, so that's an excellent question. Okay, so if a person has had COVID the CDC recommendation has been to wait 3 months to get the vaccine. They've also looked at how many antibodies you have circulating in your body after you actually have a COVID infection, and how many antibodies you have circulating in your body after you have the vaccine. There's actually more antibodies circulating after the vaccine than after you've had the disease in a lot of cases. So they still recommend that you get the vaccine. So if you get the vaccine, but you have to wait a little bit. And the reason why is because your immune system is kind of already stimulated, and then you throw something else on top, you might get just a little more sick. So they recommend waiting about 3 months and then going ahead and getting the vaccination. So does it mean you can't get it again? I mean, it's very unlikely after you get fully vaccinated that you're going to get COVID. Basically, with Moderna and Pfizer, it's like 5% or less. So it's very, very unlikely. And again, the thing is, let's say, even if you did get it, your chances of landing in the hospital and dying are pretty much zero. And that's really what we care about. I mean, if you get coronavirus and you have like just mild cold-like symptoms, you could potentially spread it to someone else, which is bad, but you personally are not going to get deathly ill and die. And so, obviously we don't want it to continue to spread. So that's something like, even if you're that 5%, you catch it, we don't want you to spread to somewhere else. That's why we want you to still mask, still wash your hands, still do all of those things, but you're not going to get seriously ill from it. So we do recommend getting vaccinated, even if you have had COVID.
And that's going to start being like a yearly vaccination, like the flu one?
That's an excellent question.
Could you repeat the question?
Honest answer is
Could you repeat the question? I don't
sorry,
think
yeah,
all of us could hear it.
I can just say, she asked if is it going to be an annual vaccine like the flu vaccine? And the honest answer is we do not know yet. It might be, it might not be. We don't have enough time left to know. I mean, these people who got the vaccinations in the studies, they're drawing antibodies on these people. So they're still doing it. So they'll probably have to wait and see how long it takes for these antibodies to decline, or if they decline. There's some vaccines that are one-time shots. There's some vaccines that are like tetanus and is like every 10 years. So we don't really know yet how long the immunity from these coronavirus vaccines is going to last. So it might end up being an annual, it might end up being every 5 years. We don't know.
Okay. And then my last question is, I don't know if you would know this one or not, is
Teresa, we can't hear you. Could you go back to where you were before? We could hear you a little clearer.
The bad connection.
A little better.
Okay, a little better?
Yes, that's much better. Thank you.
Okay. Now, I don't know if this is what you can answer or not, but going back to when you were talking about the vaccinations being made so quickly, I have a question as, and this is mine, wondering why they didn't put one for cancer and get that cancer spread quickly, and that's another a high percentage of deaf people passing away from cancer.
Yeah, I don't know if you heard it. I'm not really hearing the question.
Teresa, did you hear it?
No, you're kind of cutting in and out, Teresa. If is it too lengthy of one to put in the chat, maybe, so we can make sure your question gets answered?
Yeah. Okay. Let me put it in the chat. Let me try it.
Well, you sound good now. You sound clearer now.
Oh.
So stay right there.
Okay.
Don't move.
The question was, being that the vaccinations was, as we say, came up so quick, it was made so quick, as people would say. Me, myself personally, was wondering why they couldn't come up with a vaccination for cancer, being that a lot of people are passing from cancer.
Well, I think
or
that's
even the HIVs,
Yeah, they've been working on HIV for decades now, and it just one of the things that HIV does is it mutates rapidly. It's just a much more difficult virus to get a handle on in terms of a vaccine. They have literally been working on it. And that was one of the concerns with the coronavirus, you know, and it was really remarkable that they were able to come up with one. But I think it's the fact that we're not really making a vaccine against the genetic material that makes us sick. We're making a vaccine that attacks this spike protein, which is one of the things that allows it to infect us. So it didn't have to worry about, you know, a whole lot of the other genetic material in the COVID-19. It's like, let's just get the spike protein out of here and it can't make us sick. So I think it probably, HIV is much more complicated. Cancer is way more complicated. And again, cancer is not one disease. It's hundreds of thousands of different diseases, and they're all different. So there would never be one cancer vaccine. So, you know, they're working on it. In fact, the whole messenger RNA technology was really being more developed to kind of target gene therapy to try to address cancer. And they just happened to say, hey, we could use this for this vaccine. So, you know, it came up fast, but again, remember the messenger RNA has been worked on for like 30 years. The spike proteins have been worked on for close to 20 years. So there was already existing research that they were just able to adapt really quickly to this particular virus. But yeah, unfortunately, we can't adapt things that quickly for everything.
Okay.
These are great
you.
questions. All
Thank you.
wonderful questions. Reverend Olu, I think you
Yes,
next, and I see Mariana after.
Thank you so much, Dr. Cook. It's been just enlightening, your presentation. My question is this, I want to go back to the beginning, and that is that initially they said that this virus evolved from China. And they said that it's as a result of some people eating monkey or animal. But from time immemorial, they've been doing the same thing in China. Why now do we have coronavirus from people eating monkey? I mean, how did it evolve? I mean, did it evolve or is it, as some people suggest, that it was kind of some bacteriological warfare to see what the effect is going to be on people? And it boomeranged?
Well, viruses have been around for centuries. I mean, they're always around, they're always mutating, they're always doing different things. I mean, there's theories that I haven't heard of monkeys, I've heard of pangolins, which is another sort of strange animal. But the bottom line is, I don't think we really know exactly where it started from. That, you know, there have been naturally occurring viruses like SARS that's happened. There's been Middle Eastern respiratory syndrome virus that they do periodically pop up. And if you look back in history, pandemics, there's always a cycle of pandemics going on. So this is not the first time something like this has happened. And I can tell you, you know, the earlier pandemics, there was no biological warfare going on at that time because we didn't have the technology yet. So, I mean, I believe these are natural occurrences that happen from time to time when viruses get into a different host or the host they're not usually into, and they can cause a lot of people to be really sick.
But they seem to happen every 100 years, it seems.
Mm-hmm. Yeah, and that seems to be the natural cycle. But that kind of goes against it being something man-made, because 200 years ago, we didn't really have the technology to do that.
Thank you.
Great. Mariana?
These are great questions. They're making me have to think.
Yeah. First of all, I want to say thank you very much, Dr. Cook. We have a connection in the fact I retired from Highland. That was way back in 2012.
I recognize 2012. Okay.
So my question is that if someone, once someone is fully vaccinated, would there still be a need for that person to ever have like a antibody testing done?
Mm-hmm. Yeah, we're not antibody testing people after they've been fully vaccinated because it's been so predictable that people develop immune response. So, there have been people that have asked about that, but, people who've been in the studies and they've been vaccinated and followed along, they've got a pretty robust immune response. So no, that's not routine. We're not routinely doing that.
Okay, thank you.
But that could change with time. That could change. So again, we're still less than a year and a half into having these vaccines. So we're less than a year, from the time the study started, less than a year and a half. So we still don't know everything about it.
Wonderful. Any other questions? All really good. Angelique, did I see your hand? And hello, Sister Wilma Roundtree. It's great for you to be on the call with us also. Sister Roundtree is a member of Allen Temple, and we invited her to participate in the call as well. Okay, Angelique. You're on mute, dear. There you go.
Can you hear me now? I'm sorry.
Yes,
Thank you, Dr. Cook. I have a question. My concern is it appears that they're not due, or they haven't done much, or haven't disclosed much information about children that have contracted the disease, how they've recovered, how they've spread, and if they've passed. And we're approaching now where they're enforcing children to return to a public school environment. Has there been any talk as far as physicians and what the recommendations are for children returning to the classroom without the teachers being required to be vaccinated, the staff being required to be vaccinated, and nothing to protect them as far as a vaccination?
Well, as you know, those are ongoing discussions. We do know that in general, children, well, it's kind of a tough situation, because I look at virus, the COVID-19 virus, as a virus that cannot be trusted. So some people get it and they just get the sniffles. Other people get it and they end up in the ICU and they die. So let's start with that. It cannot be trusted. It's not that predictable. But we do know in general that children don't tend to get as sick from COVID-19. However, some children have died from COVID-19. So they do have the potential to get sick. And again, you can't trust it. So, but if you look at the numbers, and I didn't pull them up today, but if you look at the numbers for Alameda County, there's a COVID-19 dashboard, and it can show you how many people have been, documented, have cases of COVID-19 and what their death rates. And it looks at it by age, and it looks at it by ethnicity. So children are very low, but they're very low, getting sick, seriously sick and dying from it. The death rate is very low, but there's also potential for spread. But I can tell you that the whole issue with the school is an ongoing issue. It's a political issue. I know right now that vaccinations are open to teachers, and teachers are being vaccinated. If in school, any school personnel can get the vaccine now. And so I know they've been doing it. That they had 2 whole days at the Coliseum where they just did teachers and school personnel. So, but I can't tell you exactly when it's going to open up. That discussion is just ongoing.
So I live in Santa Clara County, and here the teachers are not required to get the vaccination. It's optional for them. So I know I have messaged our pediatrician and asked for her input on the return, and I haven't not gotten a response from her. And but I believe it's because of the health system. They just are not going to respond. They don't want to, take on the liability. So I was just curious as to what your take would be as far as the return.
My personal take is I would want all the staff vaccinated. Some of the young children, depends on the age, but there's young children, they're not, it's more experimental in them. They're not vaccinated. I mean, I'll put it this way. If I was the teacher, I wouldn't want to go back if I wasn't vaccinated, or a staff person. So, that's just my feeling about it. But I know the CDC has come out saying that it's not necessary for all the school staff to be vaccinated for children to return to school. So, I don't really have the answer. But I know my personal opinion.
Thank you, ma'am.
Mhm.
This has been wonderful, Dr. Cook. Thank you for thanks, first of all, for your wonderful presentation, and thank you for engaging us in this Q&A. It's about 1 minute after 1, so we just want to acknowledge where we are in terms of timing. Were there any other questions by anyone, or certainly put it in the chat if that's more comfortable for you. Want to make
Cynthia?
sure.
Yeah, there
Yeah,
is one in the
Karen.
chat there from Lentice, and I just want to make sure that got raised up. Lentice had asked, do you have any recommendations on best vitamin brands? Going back to the vitamin discussion, she said she knows that all vitamins are created, not all vitamins are created equal. So any recommendations for brands of vitamins?
I don't have any recommendations for brands, but you'll probably have to do your research. You're absolutely right. There's all kind of, and I'm not a proponent of, tons of vitamins, but, you want to make sure that they have I don't even know if I want to say, there's some government regulations that, govern how they are, but there's others that come from foreign countries. You have to do your research on it. I don't have a brand I can recommend per se.
Okay, thank you.
And I see Mary's hand up.
Yeah, you mentioned a little bit about people who might have had COVID, but it was a minor reaction, so would that have any effect, it maybe increase the immune system on them getting the vaccine and not knowing, because some people might not know that they were infected?
Oh yeah, I'm sure that's happened that, so I would say if you haven't been diagnosed with COVID, then I would go ahead and just get the vaccine on the routine schedule. But, if you've been really sick and gone in and got tested and knew that you had it, then they recommend waiting about 3 months before getting the vaccine.
Thank you. I'm getting mine on Sunday.
All right.
First dose.
Good.
Thank you, Mary. How are we doing on timing, Dr. Cook? Do you have 5 more minutes or less than that?
Mhm.
About 5 more minutes. Any other questions? Or I see Karen's hand.
I just want to, I have another one in the chat that looks like it got accidentally directed to me. I want to make sure it's heard. It's from Deacon Mike. What would you say to people who are waiting it out for herd immunity? It's a great question.
What would I say? I won't wait. I wouldn't wait for herd immunity. I think it's a little risky. You're throwing the dice if you're going to try to wait it out for herd immunity, because at any point, if you become infected, you could get seriously sick and die. People say, well, I want the Johnson & Johnson vaccine. I don't want the Moderna vaccine. Well, in the meantime, while you're waiting, you could get sick, So I personally would I happened to get Moderna. I was, sort of in 1A, but I was, the hospital doctors get top priority. I'm a clinic doctor. So I was lower in the 1A. So by the time I came around, Pfizer came out first. We were out of Pfizer, so I got Moderna. But I'm fine with either one. And frankly, if it was Johnson & Johnson that was up, I would have taken Johnson & Johnson. I'm comfortable with all of them. But I think, yeah, you're kind of gambling if you're going to wait around for herd immunity.
Yeah.
Thank you.
Great. Well, Dr. Cook, thank you so much for this time, this really rich and engaging presentation. I know our team really appreciates it. And I join the ranks of those that have had both my first and second shot. And so I'm really pleased to say I'm excited to have it completed. I had a little arm soreness, but pretty much it was a smooth journey for both of those vaccinations. Maybe a slight headache in my first one, but the second one was even better in terms of any reactions or lack thereof. So we just want to make sure that everyone gets the information, hears from those of us that have been vaccinated and gone through the process. Benny shared earlier that she'd received hers also. There may be other members on the team that have received it. I know some of you are in the process or may have had one and not the other. But we're just making sure you get the information, have the opportunity to raise questions so that you can make your best informed decision for yourself. So with that being said, Dr. Cooke, did you have any final comments that you'd like to?
I do have just one final comment. 2 weeks ago, I volunteered at the COVID-19 vaccine clinic that was put on by True Vine Ministries in West Oakland. And they are actually having a vaccine clinic Friday, Saturday, Sunday for the next couple of weekends. So if you do have caregivers or elders that you're taking care of that need the vaccine and want the vaccine, I just reached out to Dr. Donna, and she said that we could put together sort of like a list of names and stuff and get it emailed to her, and they can get folks on the schedule if they were interested.
And thank you for raising that point. Allen Temple Baptist Church, one of our leading churches in the ACCA, also has a vaccination clinic going on. And we had one last weekend. This week we're having it for, what is today? Today's Wednesday, so Tuesday, Wednesday, and Thursday.
Perfect.
So yes,
so have access. So that's the other important thing, because there's the hesitancy, but once you say, okay, I'm ready, you got to have access. So I'm happy to hear that, that they still have access. So good.
Yes, I see Teresa's hand.
Yeah, I'm sorry. Can you hear me?
Yes.
Oh, okay. Just a quick question. I know that some of the places that they get vaccinated.
Get a little closer again. You're breaking up again.
Sorry, you guys. Some of the places where they get vaccinations from, that I guess you have to be like a frontline worker or a teacher, something sort of. Is there places that you all know that anyone can get the vaccination?
If who can get the vaccination?
If anyone, they don't have to be a frontline worker. Do you know places like that?
Well, we're in phase 1C right now, which is basically 65 and over, below 18 to 64 with a medical condition. They're doing teachers, they're doing restaurant workers. So you could look up on the state website of what is phase 1C, but older people, vulnerable people, a lot of frontline workers. I don't necessarily know if all frontline workers are included in 1C, but yeah, it's a lot more wide open than it was even a month ago.
Okay, thank you, ladies.
And I would thank you, Teresa, and thank you, Dr. Cooke. I think my final comment before we actually adjourn is that Dr. Cooke, pretty much everyone you see on the call are care navigators or caregivers. It's in some form or another. And so we have hundreds of individuals that are caregivers that we support in this program. And so I want to make sure everybody has the email that we sent last week or so, I believe, that directs them to these vaccination sites like Allen Temple. And now we know that True Vine is also providing vaccinations for free. So please make sure that you reach out to me or Karen to make sure we get you that information about these two sites so that your caregivers that are, providing hands-on care to people in the home setting can have access to vaccinations in our community. So with that being said, it's about 1:10. Dr. Cooke, thank you so much again for this wonderful presentation, for your time spent and sharing. We really appreciate it. It means a lot to us. And I think it is certainly official now. Sinkler Miller is another partner of the ACCA.
That's right. Well, thank you very much. And thank you guys for listening and for your excellent questions. And I really appreciate the work that all of you are doing.
Thank you.
And thank you for all you do as serving as a physician in our communities.
Thank you.
God bless you all. Yes. Dr. Cooke may have to drop off. I don't know, but let's have a closing prayer. So very quickly. Teresa, no, that's okay, Teresa. I'm sorry, dear. We couldn't hear your prayer on and off. Mariana, would you close us out?
All right, with be my honor. Dear Father God, we come to you with gratitude and appreciative hearts and minds that we have had this opportunity to learn more from a professional in the community that can help the whole community, and especially people of color, to get the information and access they need to learn more about this COVID-19 situation we're all going through. We thank you that you've guided us all here today, woke us all up this morning with joy in our hearts, knowing that you, God, reign over all and are always in control and helping us to guide our feet to help our brothers and sisters all throughout the community. So as we part from each other's company, keep us under your everlasting protection, wrapping us in your blessed arms. And thank you, dear Lord, that we've all just had this opportunity to be together. In Jesus' name I pray, amen.
Amen.
Amen. Thank you
Amen.
so much, Mariana. All the best, everybody.
Amen.
Have a good week.
Bye.
God bless you guys. Thank you.
Spread the
Love
word.
you guys.
Thank you.
Love you too. So great to
Bye,
see you.
Teresa.